At the 2026 Healthcare Services Summit, innovation is not about chasing trends. It's also about bringing together science, validation, and real-world experience to improve patient safety. The summit serves as a meeting ground for healthcare leaders, infection prevention experts, manufacturers, and cleaning professionals who are committed to advancing cleaner, safer care environments through evidence-based solutions. And to talk about all this, joining us today is Linda Liebert, Executive Director of the Healthcare Services Institute, a division of ISSA Healthcare, along with Rich Feczko, the Chair of the ISSA Healthcare Innovations and Solutions Task Force, and he's President and founder of Elevate Innovation Group. Welcome to both of you.
Hi, Jeff.
Hi, Jeff. Thanks so much.
Absolutely. What an opportunity to dig into what people will expect and enjoy at the summit. Rich, let's start with you. And Linda, feel free to add commentary as well. But Rich, as chair of the Healthcare Innovations and Solutions Task Force, which is a long title, by the way, how do you see your vision coming into focus at the summit?
Yeah, thanks for the question, Jeff, and thanks for having me here today. The vision really is a collaboration of what the industry looks for and looks towards, including validation and so forth. So there's several lanes in innovation. I'm sure we'll speak about it over the next few moments, but really the validation of and the purpose of what fits in healthcare environments, what's good for the patients, what's good for the associates and the technicians, the clinical staff, the non-clinical staff, and so forth, and overarching the environment in itself. So those are the things in general that have been paramount to what we do from a innovation review or scout team standpoint, and the items and the technologies that we review.
Rich, talk a little bit about the review and what you're doing with your task force.
Yeah, great point. So we tried to break the innovations down into buckets. So everything from ultraviolet technology, stationary and autonomous, to digital transformation, privacy curtains, robotic technology in floor machines, and so forth. We review those suppliers, virtually review their demonstrations. We have somewhat of I would call it a scorecard, to where we look at things from a regulatory compliance standpoint, efficacy, validation, task time, run times, and so forth. Back end information, air quality is another, energy savings, and so forth, which brings about all of the tangible items that healthcare environments are looking for to be difference makers, both in the standalone as well as the BSC spaces.
Linda, let me ask you this. How do you feel about all this coming together?
Really excited because one of the components of the summit this year is a kind of I want to say a debate or a dual panel where we're going to have Rich and some of the people that he has reviewed sit on a panel, talk about their innovation and how it can support healthcare professionals. And then we're going to have a panel of healthcare professionals and clinicians talk about the challenges and some of the things they run into when they bring new innovation into their facility. And so Rich has been extremely instrumental with his team in recognizing challenges or gaps in these innovation before it's being presented to healthcare professionals. So we're really looking forward to having those two panels work together.
Rich, these events, these summits, any conference is about lectures, presentations, great minds coming together. Can you talk about the results that will come out of the summit later on?
Yeah, so another great point. So the cool thing for me is I've spent at least half of my career in looking at and vetting and reviewing industry technology that makes a difference for purpose, that isn't just a sales pitch. And the cool thing that Linda's allowed here, and I know Barbara Strain and others within the hierarchy of the healthcare team, has been the idea around validation and purpose versus just a product that someone may be interested in. So the fulfillment of the practical end alongside the purpose and the validation component of what we're trying to achieve has been cornerstone to how we can influence the healthcare environments that we are providing guidance to, not only here in the U.S. but globally.
One of the things, Rich, that we have talked about, and one of the purposes of the summit and ISSA Healthcare actually, is to really start to build bridges and fill gaps that currently exist. Because typically things are, different clinicians, manufacturers, everybody's sort of in their own silo of expertise, which is normal. And what we're trying to do is begin to build those bridges between manufacturer and the clinical staff. And your team, your task force, consists of a variety of expertise that will help build those bridges. Can you share a little bit more about that? Who sits on this review board?
Yeah, such a great point. The review board is a component of operational folks. Like most of my background has been EVS, facilities management. We have some clinical folks that sit on our task force as well. We have international folks. We have Stephen Moore from Australia. So it's not just a North American team. It's a combination of a global team. And we have some consultants who have been in the business as well, both BSC space as well as self-op or self-performing locations as well. And I wanted to hit on something earlier you said, Linda, about gaps. The gap analysis of what the team is trying to achieve comes with that same purpose. So oftentimes a supplier, a manufacturer will bring a product to the table at a location. We're working with perhaps infection prevention, facilities management, the vice presidents of operations, the COO even, and they're looking at the product but there could be some things that are missing, and we're looking for those things that could help bridge those gaps and fill in the components that make sense from a practical element, but also the efficiency, efficacy, and validation that brings that purpose to life for us.
Well, and again, it also opens up the lines of communications between them. And I was fortunate enough to sit in on one of these. And we actually were able to give some recommendations to that manufacturer about something they hadn't actually thought about. And so it actually works both for the manufacturer as well as the clinical staff in evaluating a product. So I've always been excited about your group and what you're doing, and it'll be really fun to have them all together at the summit.
If I may just add two things. First and foremost, and I should have said this earlier, thanks to Linda for having me on this team. It's been a true honor and a pleasure to be able to expand the opportunity for innovation in a more global sense versus a singular sense. The other component of that is it is true to have that collaboration, environmental facilities management, patient safety, patient outcomes in ways that sometimes we don't even realize. And so kind of to Linda's point, the idea of being able to have experts in the industry that have an opportunity to have a review, but also it's a two-way street. The suppliers themselves have learned some things from the team that could optimize not only their technology and how it fits, because there's not always a one size fits all, but also some of the terminology that we use in healthcare that sometimes from a supplier standpoint, they're not always aware of. So that's been helpful for the suppliers. A couple of examples that I can recall.
Well, thank you both for this today. Linda, we have one more very important thing to share with those watching. How can they learn more and register for the summit?
So register today. Limited space, remember 120 participants only. Manufacturers, clinicians. It's a great networking opportunity. It's really unlike any other conference you may attend because it's a collaboration of all of these people together. So please join us. We look forward to seeing you at the summit.